Hi guys, my name is Peter from Art of Physio, and in this video we're going to talk a little bit about the psoas. So before we get to the psoas, it's important to learn a little bit about muscles. So muscles are happiest if we fully shorten and fully lengthen them over their full range of motion. Yeah, what that does, that stimulates circulation, it stimulates blood flow, and all the muscle fibers and all the fibers that are there are worked and used and get some motion and get some action going. Yeah, when we keep a muscle in a lengthened or a shortened position, it might get a little bit tight, it might get a little bit stuck and not function optimally anymore. Yeah, and the psoas is one of those muscles that if you sit a lot, it's constantly on a more shortened position, and it can actually cause hip tightness, it can cause some lower back pain, it can cause some overall achiness and tightness of the body. So it's quite important to keep that muscle active and working. Yeah, and a lot of people, they know how to stretch it, but not a lot of people know how to shorten it. And by actually shortening the psoas, it can help you to alleviate tight hamstrings, it can help you to alleviate your lower back. So it's pretty important to check this out with yourself to see if this creates any kind of benefit for you. But actively shortening muscles is always something worth doing. So, let's do a little test. So you're going to sit up straight. I'm going to show you from the front side and from the side. So I'm going to sit all the way up. My chest is up. My lower back is a little bit arched. And what I'm going to do, I'm just going to lift up my knee or my foot. And you'll see that the motion isn't that big. I just lifted up 2 centimeters. Yeah, and that's enough. So now the muscles that I feel working are here. And the test for you is to see, is it just your hip that is moving, so just here, or is this what's happening? If this is what is happening, it's so for the sake of this exercise, we really want to keep that lower back arched, because we don't want to make it a lower back exercise. We wanted to make it a psoas exercise, so a hip flexor exercise. Yeah, so this is the test, which can also turn into an exercise. So this bench is for me at about 90 degrees in hip flexion. If this is really hard for you in this position, start with a bit of a higher seat. That gives you a little bit more space to work with and to shorten that muscle. So I'm just going to do this for reps. So I'm going to arch my back and I'm going to lift up and then lift up. And it's okay if I really feel some tightness or some crampiness here on the front side of the hip. That's fine, that's normal, but it shouldn't be like, that you can't move your hip. So a bit of uncomfortableness is okay, but we don't actually want to be cramping all over the place. Yeah, so this is one exercise you can do. This is sitting, and you'll notice quite fast that it's becoming pretty hard to do. Yeah, you can also do this standing, where I stand up straight all the way, and I just move my leg up until I feel like my lower back is joining the party. Then I do that same on the other side. And what I want to do is I want to feel the muscles contract here on the front side of the hip. So that's where I'm focusing on. There, there. Yeah, if this is easy for you, we can also go a little bit to the side and then up. Yeah, from the front side it looks like this. Go to the side. Yeah, we can also do that same thing sitting again, where we go up to the side and down, up to the middle and down. You'll start to feel that all the other muscles that are working here are also joining the party, and that's fine. So the moment we move outwards, we're going to use more of the muscles that are here on the outside, and then we move back in, we're getting the psoas again. So you can do this on both sides, and you will probably feel that one side is easier than the other one. Yeah, if you want to make this really hard on yourself, here's another exercise that you can do. So we're going to go to that standing position. I'm going to pull my leg up, and I'm going to feel where my end range is. And my end range, what that means is, where can I pull my knee up until my lower back and my other muscles and my other joints are starting to compensate. So for me, that's about here. I actively arch my back, and what I'm going to do now is I'm going to let go of that leg. And I'm going to try to keep that knee in that same position. And that's going to require quite a hard contraction of all the muscles that are here. And I grab it again, lower it down, and reset. Also here, I can go all the way to the outside, do that same thing, hold, squeeze, and then lower it down. Yeah, you'll start to feel that that's pretty hard to do already. Standing are not nice for you. Then you can also do that same thing laying on your back. So I'm going to grab my knee, I'm going to find the end range of my hip. So that's about here. I lay my head down. And what I'm going to do now, I'm going to let go of my knee, and I want to keep it in this position. Yeah, and that's going to force me to contract all the muscles that are here on the front side, among which the psoas. If I want to make this a little bit harder, I push into my hand, or I push into my knee with my hand. And you don't need a lot of tension to really ramp up the amount of contraction that you have here in your hip. Yeah, so if you sit a lot, try out this exercise or try out these exercises and see how it makes you feel in the way your hip moves now. Yeah, it should make you feel better. It should make it feel more relaxed. It should make it feel more fluid. And this is a great way to increase the strength there. If we're going to bring this back to where you would need this muscle to contract, when you do squats, when you do lunges, anytime your hip goes into a flexed position, you want to actively be able to shorten the muscles that are here on the front side. So by doing this, you will improve your depth of your squat position. You might improve the depth of your split squats or lunges, and it's definitely going to create an overall better functioning hip that you kind of want. Yes, so try this out and let me know if you have any questions.